Thank you, Senator Casey. Senator Cassidy.
I defer to Senator Romney.
Thank you, Ranking Member Cassidy. Dr. Walensky, Dr. Califf, I interacted with you a number of times. I don't know Ms. O'Connell as well, but I respect you as individuals and physicians who have demonstrated integrity and capacity and commitment to the oath that you've taken to the nation, but also to your patients. Let me ask each of you, how many employees do you have that you're responsible for in your agency? Just go down the row approximately.
About 1,000.
About 1,000?
About 12,000 and about twice the number of contractors.
Okay, thank you.
19,000.
Yeah. I know there are some people who feel that these individuals must be corrupt or must be bad. They work for the government. They must have ulterior motives. My experience in dealing with those that I've dealt with is that they're good people. They're brothers, sisters, moms, dads, and they're trying to do the best job they possibly can. I sometimes worry that a projection that other people are evil somehow creates false impressions about how effective our various agencies are, and hope that you and others recognize that the great majority of us, certainly in this body, respect and admire the work you do. Let me ask you if there are any things you think we need to do to improve the integrity and the credibility that is held by the public for your respective agencies. So, for instance, prohibitions on owning stocks in pharmaceutical companies. I mean, I hear all the time, oh, the FDA approved that because the people looking at it were investors in that company. Is this an issue that you're concerned about? Does this exist in your various agencies? Dr. Califf?
Well, since you mentioned FDA specifically, let me just say FDA officials or employees are prohibited from owning any stocks in any of the relevant entities that they regulate. And for us, that's almost, it's 20% of the economy. So even like airlines, because they serve food, and food is a big part of our equation. So I take great pride and really appreciate what you said. What could be done to help the most is say a few nice things about federal employees. They work hard, and we can verify they work extremely hard, particularly during the pandemic. They were doing all the regular work plus the pandemic work at the same time.
Thank you. Dr. Walensky.
I would just echo the gratitude for your comments and just say that, I have an agency that is working 24/7 to take care of health and public health. They're not getting credit for it. What happens when there's a massive pandemic that affects 330 Americans is that they had a frail infrastructure to start with. They were working 24/7. Their job is to protect the public from public health so that you don't have to worry about it. So a few nice things, I would say, would go a really long way.
Thank you. I was personally concerned, and I know many others were, about the data that was available to the public from our government about what was happening with COVID, who was getting it, what age groups were getting it. I was a little dismayed that I went to Johns Hopkins to get the data as opposed to coming to the CDC or NIH or whatever, and you indicated that you're making strides to improve our systems for data collection. You also indicated that from many institutions, the data that comes is only voluntarily provided. Are you suggesting that we really need to have some kind of mandatory reporting, obviously on a basis where people can't possibly be identified personally, but do we need to do something to have a better system of collecting data and providing that to the public as well as to practitioners?
Yeah, let me just note that during the right after the public health emergency, it took CDC 6 months in order to be able to negotiate data use agreements in order to receive hospitalization data, which is why the web scraping of Johns Hopkins was a very efficient way to do this while we were working with our lawyers to do data use agreements. Very similar things happen with Mpox. If we are supposed to and responsible for stopping disease outbreaks before they start, before they become emergencies, we have to have line of sight as to those when those urgent issues, those infectious threats are sparked. And the only way we do that is by getting the reporting coming into CDC so that we can, again, give it back to the communities and they know that this rare thing that they happened in their county is actually also happening in the county next to them.
All right, thank you. I haven't much time. I'd love to steal the time from the people who gave it up, but I won't do that. Ms. O'Connell, just to ask a question, one thing to stockpile, for instance, masks and PPE. It's another to stockpile the machines that make those things. How do you make a decision about whether to keep productive capacity in place as opposed to just keeping masks in place. And are we making the right choice in that regard from your perspective?
Senator Romney, thank you so much for that question. That's exactly what we're working to do now, which is make sure that the stockpile is only one part of the supply chain continuum. But, so what we have on hand and the stockpile is critical in the early hours or weeks of a response while we ramp up what we have in the supply chain. But both should work together. The hospital employees that had to, wear bandanas instead of real masks should have been able to access those on the commercial market. We're not able to. Stockpiles there to back that up should have been there, to be a backstop for that. But if both are running well and we're investing in our domestic manufacturing so that supply chain is stronger and more resilient, if both are running well, we will not need the stockpile and we can rely on the supply chain. But when that gets pinched, we'll have the stockpile.
Mr. Chairman, thank you.
Thank you. Senator Baldwin.
Thank you, Mr. Chairman. I want to thank our witnesses for